And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap that exists between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 77, I'm joined by Dr. Daphne Bascom. Daphne is someone who has a very diverse background, certainly in medicine, but also in population health. As you'll hear her explain her background when we start the podcast, she's been a surgeon in her past. She's transitioned into population health. She's been a medical director for a YMCA, and now she's very, very much involved in the population health around a lot of the pillars of lifestyle medicine. But this conversation is a unique conversation for the wellness paradox. And maybe the first time we've actually talked about it to any great length. It's a conversation around health equity and the critical role that fitness professionals play in the health equity conversation. And to pull a quote from the podcast with Daphne, the whole concept that your life expectancy, your longevity, and how well you live your life should probably be more dictated by your genetic code than your zip code, but in many cases, it's decidedly not. And the question is, what role do fitness professionals play in health equity, and how can we go about effectuating that role in our communities? I think this is going to be a very illuminating conversation for many of you, simply because you probably haven't engaged very much with the concept of health equity before. Any information we'd like to share with you from today's episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 77. Please enjoy this conversation with Daphne Bascom. Today, we're delighted to be joined by Daphne Bascom. Daphne, thank you so much for joining us.
I appreciate it. Thank you for allowing me to join you today.
I'm very excited for this discussion. You and I connected a while back through, I think, Sammy Mansfield, another guest of the Wellness Paradox podcast, a cancer exercise specialist. And she connected us because she thought we would have a lot in common. Turns out we do, and we actually narrowed that down to a topic for this conversation, which I'm excited about. But before we jump into that, Daphne, why don't you give us a little bit more idea of your background, just to provide some context here?
I appreciate it. And yes, it was Sammy that connected us. And if Sammy's listening today, thank you. So, Mike, I am a head and neck surgeon by background. I trained in head and neck oncology. I'm no longer practicing and have pivoted my career to focus on disease prevention rather than disease treatment. So, trained at the University of Pittsburgh Medical Center, did a fellowship in head and neck reconstruction at the Oregon Health Sciences University, was on staff at University Hospitals of Cleveland in Cleveland, Ohio, and pivoted my career there and spent the next 10 or so years doing health information technology. I think my exposure at that point to population health, I mean, a lot of things have happened in the healthcare industry over the past 20 years. And from a physician's perspective, I never really understood what population health was because my population was my panel.
Yeah.
But by working through the time I spent at Cerner and with some of the amazing clients I'd work with, got a better understanding of what it meant to manage the health of populations. And that's on a global basis. From there, decided that really wanted to get more of a grassroots understanding of what health means at the population level, and spent several years working with the YMCA. I was the medical director of the YMCA of Greater Kansas City, and subsequently also was able to support the National Y as their interim medical director. And so when we talk about health equity and fitness, I would love to use the Y as an outstanding example of an organization that has focused on this for years. After from the Y, I had several other transitions, working with St. Luke's Health System in Kansas City as their vice president for population health, working as a consultant for MITRE in McLean, Virginia. And since we last spoke, most recently, I am now working with the Vegan Gym, which is the largest vegan health coaching organization globally.
Yeah, I love your diverse background and experience. And I do find it interesting how, as a physician, population health was somewhat foreign to you, and because your population, as you said, it was the people who were coming into your OR, on a weekly basis. So I'm really excited to have this discussion, particularly around health equity, because it's something I'm very passionate about. And I don't even know if I said this to you on the first call we had when we were chatting, but the YMCA also holds a very special place in my heart, because when I was 13 years old, way back in 1993, when a teenager couldn't really walk into a gym or fitness center and exercise, you almost had to be 18 to work out anywhere. A little YMCA in Westland, Michigan was the place where I got my start in the industry. I mean, I fell in love with the gym, and I was wiping down benches and getting a free membership at 15 years old. And so I'm excited to talk about the topic of health equity, because it's near and dear to my heart, but through the lens of the why and your experience, I'm excited just to hear your thoughts on it. So, health equity obviously is of great interest and concern in healthcare. As our listeners probably know, the end of September, the White House convened really its second conference in a century on health, nutrition, physical activity, and a lot of it was focused around equity. So this is a very timely conversation, but I think we need to start with just level setting and a definition around health equity, because although healthcare talks about it a lot, the term is very novel in the fitness space. So if you could define health equity as you see it.
Mike, you're correct. And I'm going to define it from the perspective of well-known organizations, not necessarily from Daphne's perspective.
Okay.
So I want to start with the World Health Organization's definition of health equity, which is the absence of avoidable or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically. Now, I also want to, that's a very broad and global term, but really I think what we're talking about, and then I want to pivot to how the CDC talks about health equity, which is how do we achieve health equity? I mean, saying that we need to be equitable is great, but where I think we are focused and where we're both passionate is how we remove the barriers to health equity. So the CDC feels that health equity will be achieved when every person has the opportunity to attain his or her full health potential. And no one is disadvantaged from achieving that potential because of their social position, or other socially determined circumstances.
Yeah, and I think it's great to frame it up like that. And so we at least have this definitional understanding of it. But as you said, I think what you and I are passionate about is actually translating that into action. And a good friend of mine, Tony Moreno, who's a professor at Eastern Michigan University here in our backyard, he's on this mission for no more white papers. He says we have enough white papers on all of this, and now we need action. So, and that's really what this conversation is going to move towards, is how people who are in the fitness industry can actually be involved in health equity. But just to put a real practical context on it for people that are in the Washtenaw County area, obviously our podcast being associated with University of Michigan. University of Michigan is located right in Washtenaw County. There's some very well-known research that basically shows a dividing line of US 23, which basically divides Ann Arbor and Ypsilanti, Ann Arbor being a more affluent community, Ypsilanti being a less affluent community, and a distance of about 10 miles by way of zip code. and a 10-year plus difference in life expectancy with the more affluent zip code, leading to a longer life. And I think at its most fundamental level, that's what we're talking about here, making sure people live longer and making sure people live healthier. And that is irrespective of their zip code or their socioeconomic status and all of these other factors. So that gets to the heart, I think, of this discussion.
I agree with you. And I was actually going to follow up by saying, why is this important? And you just nailed it. We need to remove those disparities. You know, when I was in Kansas City, we had the same thing, which it was called the Truce Divide. And that one street, there was a 9-year difference in life expectancy if you were born and raised on one side of Truce. You have the same type of socioeconomic challenges in your own community. But why should that be? Why should, to use a phrase that perhaps is overused, why should your zip code be more important than your genetic code? From a broader community perspective, and even from a national perspective, and why the White House conference was so important, is that these ongoing health inequities are impacting the health of our nation globally. You know what? We will not be a healthier nation if we don't address some of these disparities, because we can no longer afford the cost of chronic disease. We can no longer afford to have a community that is not achieving a better level of health for generation over generation.
Yeah, you said it. And the thing that I'm most excited about this discussion is I think bringing awareness to the issue is obviously the first step to starting to address it. And a lot of the fitness professionals that listen to our podcast, I think they simply lack awareness of this, given just the nature of the economics of our profession. If you're a fitness professional, you're working with people who have substantial socioeconomic means because they're able to pay you out of pocket for their $75 to $100 per hour training session. But on the flip side of that, we're kind of at the grassroots, like a lot of the organizations you work with and have worked for, like the YMCA in the past. Like, we can be the front line to health equity with fewer barriers than even healthcare in some cases, because we don't have all of the restrictions and regulations and complexity. So, let's start to drill down on this. Why do you think it's important for the fitness industry and for fitness professionals themselves to be involved in the health equity conversation in the first place? Before we even get into how they should be involved, why is it important for them to be involved?
Multiple reasons. So I think of health professionals. So the fitness industry, I think, is becoming a broader component of the healthcare team. So we as fitness professionals have an opportunity to, one, impact the life of everyone that's walking in our door. But more importantly, what are we doing for those that are not walking through the door? So it's important for fitness professionals to understand and feel comfortable with the fact that there are social factors that may impact a community member's ability to have safe places to walk, to get to a gym, or provide alternatives in communities where there may not be a community center or YMCA or Boys and Girls Club, to have structured physical activity so that whether it's the kiddos or the seniors have the ability to get and remain physically active. But from a fitness professional perspective, I also think it's important and incumbent on us to feel comfortable asking the questions. I mean, most of us have a relatively structured intake assessment and we go through a lot of the normal, biometric parameters, demographic parameters, but how many of us actually ask the questions related to, even if I give you a fitness program, do you have a way to execute on this longitudinally? Do you have a safe place to walk? Are you able to support your nutrition so that you can achieve your health goals? I mean, these are elements of health equity that can and should be structured into our intake assessment to help us, one, serve those better who are coming in our door. Another nuance to that is similar to what you're doing and partnering with some larger healthcare systems. You have the ability to engage as a fitness professional in two ways, one in prevention and one in treatment. So on the preventive side, what programs can you partner with, whether it's a large health system or a community center, but what offerings can you provide to your community to help showcase the importance of why being physically active is so important? And, that's the genesis of programs like Walk with a Doc,
Yeah.
or, some things that we were doing in our local community where we just got people to get out and be physically active together, even if it was just walking the streets. So there's a preventive component where you'll get people together, you'll provide some social connectivity, and you'll provide some education about why being physically active is important. And when you have that trust and people know you're there and you're invested in them, you can start to have some of these other conversations.
Yeah.
From your partnership with healthcare, you open up a whole nother realm of opportunity in terms of treatment and subsequent reversal of chronic disease.
Yeah, that's wow. There's a lot there to unpack, and I do want to go back to one of the first things that you said because it's interesting because it never actually struck me until you said it. I know in healthcare there is a social determinants of health assessment that is actually done, and it's now baked into a lot of the evaluations that are done, at the clinical level, and the fact that you're mentioning that for fitness professionals, even somebody like me who actually has I think a broader perspective on this, that's actually not something that I even thought of as directly, but that's essentially what you're saying there is, hey, yes, we need to be determining weight and waist circumference and hand grip strength, but also, let's look at these social determinants of health and evaluate that. So I think that's a great pearl to take away from this because I that's not included in your standard lifestyle health history questionnaire as it's structured right now.
And not for most of us. I mean, I am a member of the American College of Lifestyle Medicine, and we have a member interest group solely focused on fitness professionals and health coaching. And I think with the pillars of lifestyle medicine, the nutrition, the physical activity, the social connection, the stress, the sleep, and avoiding behaviors that may not contribute to your health, we are trying to find ways through our health equity group of weaving these conversations into every health professional's role in the community, because we're not trained to do it. And there's always this feeling, if I ask the question and someone gives me an answer that I don't know how to respond to, how do I do that? But in your position with the university, how do you start to include that as part of the curriculum so that fitness professionals and health professionals alike are comfortable asking these questions as they are asking, how much do you weigh?
Yeah, absolutely. And the ACLM, we've had many people associated with the ACLM on this podcast: Tom Rafai, David Katz, Kate Collins. I can go down the list, and there's an obvious connection between the lifestyle medicine world and what we do as evidence-based fitness professionals that want to move towards healthcare. And I will link up on the show notes page again because I don't think we can provide this connection enough information on the ACLM for everyone in our audience to be able to find out a little bit more information about them. So I want to start to zoom in a little bit more actionably here, right? So we've established health equity. We've established why this is important for fitness professionals to get involved in this. Now we can get to the how, and this is where I love to draw on your experiences from the past as well as where you see the future going, and maybe inspiring some of the people that are listening to this to pick up that torch and carry it on to broader reaches of the industry.
Oh, that's a big question.
Nothing like a big question.
So I would like to encourage anyone listening. So the first thing is that, and kudos to the White House for the recent conference where we actually started to have conversations around these topics. But I think there are multiple national and global fitness professional organizations that can take an even stronger advocacy perspective in terms of helping on a national basis understand why we need to support and fund access to physical activity, resources, education, and why it's not a nice to have, but it's a must have. There's been a lot about physical activity guidelines and, we talk about it, but we don't do it. And I even see it from the perspective of, the school level. Are we really having kids as physically active in grade school and going up into high school as they could or should be? Yeah. So my first message is you need to have these conversations with policymakers locally and nationally to find ways, if you have those areas in your community where you don't have a safe place to be active, especially for kiddos and seniors, or you don't have access to other factors that can contribute positively to your health, we need to be that voice, and we need to be active in helping us move forward with providing those resources to the community. I think another opportunity for fitness professionals is to partner with other organizations in terms of looking for grants and other seed dollars that can help provide opportunities in communities that might not have access to, resources like yours. Grants are not they're not sustainable. It's not a never-ending fund of, source of funds to stand up programs and make them sustainable. But sometimes that nidus of funding and the investment in the community can create a opportunity to have it continue to grow in a way that we may never think about when we're first conceptualizing, how do I launch a new program in a community where I know there's need? So I do think those partnerships with community organizations like the Y, like the Boys and Girls Club, where there's already trust in the community members in those organizations, and partnering with fitness professionals or organizations like yours to bring programming to the community rather than waiting for them to come to us is another way that we can take actionable steps to make physical activity, education, and programs available on a more widespread basis.
I'd like to take a quick break from today's episode to tell you a little something about one of our sponsors. As all of you are well aware, addressing the wellness paradox is a lifelong passion project for me. And when you're going to go on a long journey, it's difficult to go it alone. You need to find like-minded individuals that are willing to go on that crusade with you. And that's exactly what I found at the MRF Institute. The team over at the MRF Institute creates educational content for fitness and wellness professionals who are serious about becoming a part of our healthcare continuum. Getting on the healthcare continuum is all about leveling up our skills to be looked at as that valued resource provider. The wellness paradox is certainly an avenue for you to do that, but we need many different levers to pull if we're going to get there. And the MRF Institute is definitely one of those levers. You can go to their website, mrfinstitute.org, to find all kinds of great, informative, free informational content. And if you choose to engage with any of their paid content, they've created a coupon code specifically for Wellness Paradox listeners. You can enter in WP 2022, that's WP, and then the number 2022 to the website at checkout to receive a 15% discount on your purchase. I highly recommend you go check out mrfinstitute.org. Now back to today's episode. And amen to that. Like, we as an industry have spent so much time waiting for people to walk through our doors. And the reality is that we've seen the effect of that. It's 15 to 20% of the public walks through our doors. And if we're ever going to get to that other 80%, we have to meet them where they're at. So what you just said there in terms of the Ys and the United Ways and the Boys and Girls Clubs and all these community organizations that have trust, that's where the people are that we're not serving. So we have to figure out a way to go there. So I just wanted to point that out for everyone that's listening. We have to be open to getting outside of our own four walls.
Amen. Uh, and and it's not just, I mean, everyone's busy, and I know that these sometimes may seem like big, hairy, audacious goals,
Mhm.
but if our mission is really to impact health, we can't wait for people to walk in our door.
Mhm.
And it's the same thing with healthcare systems. I feel strongly that people walk in the door of a healthcare system when they're in need of healthcare,
Yeah.
not necessarily to prevent them developing a chronic disease. So if we don't move toward a more preventive mindset and we push out and move into the communities and deliver programming from kids up to seniors, we're not really going to improve the health of our nation, because why would we expect a different outcome if we're doing the same thing?
Yeah, absolutely. So let's get even more specific, because I mean you've done this. I mean, so the things that we're talking about, in various ways, shape, or forms, you've done, particularly with the Y. Can you give us some examples, at least on a high level, of some programs that you've been involved in that have been effective and you think could be replicable in other communities?
So I'm a big, as you can tell, I'm a fan of the YMCA,
Uh-huh.
and I'm a fan of the Boys and Girls Club. Um, at the YMCA, the Y is probably the best opportunity to do population health on a national level,
Mhm.
because there's a Y within around 6 to 9 miles of most people's households.
Hmm.
Um, the Y was one of the first organizations to start delivering the diabetes prevention program at the community level. They have programs such as the blood pressure self-monitoring program. They have a program for cancer survivors or cancer thrivers, let's say. So those are, the Y already has an infrastructure for delivering health-related programming to specific communities. And those are great opportunities for fitness professionals to partner in novel ways
Mhm.
and work with them to expand the reach of those programs, whether it's referral into existing programs or partnership to help expand delivery of the programs. Um, I think the DPP, the Diabetes Prevention Program, has struggled.
Mhm.
Um, we all know, partly because there's a financial challenge with delivering the DPP on a wide scale basis, but that doesn't mean that we should give up on it
Mhm.
wholeheartedly. And the same thing with the blood pressure self-monitoring program. I mean, we know that cardiovascular disease is still the major killer for men or women nationally.
Mhm.
If we can teach and help our community understand what healthy eating, what monitoring your blood pressure, some very easy, basic principles that will help keep people healthier, why don't we partner with them? Um, and then, the other opportunity, so those are structured programs with evidence-based curricula, many of which are delivered by the YMCA, and they continue to grow their portfolio of programs and partnerships.
Mhm.
The Ys have partnered closely with healthcare to create true wellness centers. I
Mhm.
mean, when I was in Kansas City, we actually had a YMCA that was part of a clinic with one of our um, local medical centers,
Mm.
so that you walked in one door, you walked into the clinic, you walked in the other door, you walked into the Y.
Yeah.
But the model was that this was a place where we could refer community members back and forth in order to create a care plan that would be whole health related,
Mhm.
not just disease related, but health and care related. And then finally, another program that was able to be funded, it's near and dear to my heart, even though I'm not still in Kansas City, was a program in partnership with the Boys and Girls Club, where we structured programming via Zoom or in person that provided opportunities to work with the community on nutrition, physical activity, but they were based on the family unit.
Mm.
So, another fundamental concept is, if we treat if we treat the family as an intergenerational opportunity to help change those behaviors, then we can break some of those generational trends related to diseases that people think just run in the family, but they really probably run in the lifestyle or opportunities for that family.
Yeah, such a good point, and so many great opportunities. And yes, you said it. All of these programs have their challenges and their nuance to implementing, but that doesn't mean we shouldn't keep working on them. And it also doesn't mean we shouldn't start to be creative to see what new programs we can develop over time as well. Because we're only constrained by our creativity on many of these things.
I would agree with you.
So,
and not to say that, I mean, the other thing is fail fast.
yeah.
So a lot of people, I was actually just, chatting with a client about perfection paralysis. If you wait for everything to be perfect, you'll never get started.
Yes.
Go ask the community. And I am really strongly saying, go ask the community. Don't assume you know what they need. Partner with them. Ask them what they need, how it can be delivered, when is the best time. But if they walk hand in hand with you, it's more likely to be sustainable than if you come in and, with a paternalistic perspective and say, we know what you need. That's not what I'm saying. It really is walk in and say, how can we work together to make all of us healthier?
Yeah, I think that's really well said. And for those of us who are, who have a coaching mindset, that's the same way that we would interact with the client that we're coaching. Hey, I'm going to come alongside you. We're going to collaborate on this together. It's not the paternalistic expert view of, there it is, you need to go do that. And, look, we've tried that in healthcare and wellness coaching and fitness, and it clearly doesn't work. So, the other approach of collaborating, I think, is very important. To what extent do you think, for fitness professionals who are listening to this and they're hearing a lot of this for the first time, I would imagine this can kind of be like, drinking from a fire hose to a certain extent. Like, wow, these seem like some big issues. And so I like to give people some actionable places to go and to start. To what extent do you think like the hospital system's community needs analyses that they're all required to do if they get federal funding, which are many hospitals? Do you think that is, so I guess maybe first, if you could explain what that is for the audience. And secondly, do you think that is maybe a good starting point to see where the needs are in your community?
Mike, thank you. That is actually a great opportunity. So most hospitals complete what's called a community health needs assessment, or a CHNA, as you may hear it referenced if you're working with healthcare. And it is an assessment of what the needs of the community they serve are. And then as a byproduct of that community health needs assessment, which can be done by the healthcare system, or it could even be done by the public health department of a locality, they would then create an action plan to determine, here's what we need to do to address overweight and obesity, lack of safe places to be physically active, or lack of access to healthy foods and produce. So if your community, if you partner with the healthcare system, you should be able to go on their website, and these are for nonprofit healthcare systems, and access their community health needs assessment. And that is a great indicator of, on a regional basis, what may be the needs of that community. And, for frequently, most of the top three are the ones I ticked off.
Right.
The public health department may have a similar one. And there are some communities that are trying to bring multiple healthcare systems together to try and look at one CHNA, as opposed to each healthcare system doing their own thing, mainly because it's more efficient use of dollars and resources. But go to the healthcare system website, or go to the public health website, your public health department website, and you should be able to find a community health needs assessment that will give you a good directional indicator of the zip codes that may be a great opportunity to partner with, and the healthcare systems that are investing in their community to help address some of the health inequities.
Awesome. Yeah. Thank you for that, because I think that's hearing that from your perspective, I think is just helpful to frame that up. The other thing that comes to my mind as well, I just think on the local level here, we also have a federally qualified health clinic in Packard Health that is a very prominent local organization. What do you think about that? Kind of in the same vein that I asked on the community health needs assessment. Maybe define what a federally qualified health clinic is, and then do you think that could be a path?
Absolutely, yes, and I'm glad you brought that up. So federally qualified health centers are, don't know if I know the real definition. They are community-based health centers that receive federal funding to support the needs frequently of underserved communities. They are, so again, when I was in Kansas City, we partnered with Samuel Rogers, which was one of our primary federally health FQHCs, to deliver some of these programs. FQHCs are mission-driven. They they often have opportunities to engage with the community, and they welcome fitness professionals or other health professionals who may want to partner with them to deliver these programs on a community basis. Again, funding can be a challenge. And so there's always, how do we do it? We want to go do it. How do we do it? But there are also programs, even on a national level. The blood pressure self-monitoring program that we launched in partnership with Sam Rogers was actually funded by the CDC. So we went together we saw an opportunity to get funds. The FQHC we delivered the program on their location. So we know it was a place where people were already going to. It was in the community. So transportation was not a barrier to get there. But to directly answer your question, if you have community health centers or federally qualified health centers that receive subsidy from the national government to support underserved communities, they are frequently great partners in finding creative ways to deliver programming and would welcome fitness professionals to partner with them.
Absolutely. Yes. They're great partners, and they're very willing partners as well, because they don't have fitness professionals typically within their stable of allied health providers. We sit on the outside. And I could say from personal experience here in Ann Arbor with our FQHC Packard Health, when I spoke with them, the first word out of their mouth was diabetes, which is no surprise that would be something that would impact that population. And I've said many times before on the podcast, if there is a great opportunity for fitness professionals to influence population health, it is with diabetes. Just for all the mechanistic reasons that movement just helps to improve blood sugar control. And so that's something we're looking into here locally, how we do that. But they have a lot of expertise, but they don't necessarily have the physical activity or exercise expertise. So I do think it gives us this unique opportunity to partner.
And you can even ask them for, the population they serve. Prediabetes is another great opportunity, which may be a mountain as big as, community members with diabetes. Yeah. But they will direct you. If we can prevent people from getting diabetes, you've done a good thing.
Yeah, absolutely. And I feel like we could go down that rabbit hole for a while, and because I think it is the next pandemic that is coming may very well be diabetes. And to the best of my knowledge, and I think yours, there's no vaccine that's coming to save us from diabetes. So we better figure out something there quick.
Our vaccine is lifestyle.
Yes. Well said.
And it's already here. We just have to use it.
I know. The problem is I feel like there's more issues with that vaccine uptake than there is even with COVID vaccine uptake, sadly. But
yeah, we won't go there.
Yes, metaphors aside. So, Daphne, this has been a great discussion because, again, I think if nothing else, it's very illuminating for fitness professionals to hear these things. I would suspect in some cases for the first time. And before we bring this to a close, is there any last take-home message you'd like to leave the fitness professionals that are listening to this podcast on this particular topic?
First of all, thank you for the opportunity. And I hope that this has been helpful to all the fitness professionals listening to know, one, you impact every life you touch, and you have an opportunity to impact even more lives. You need to be empathic. You need to walk in the shoes of those who are coming in your door, but also think about those who aren't coming in your door and what can you do to meet them where they are, because you have such a wealth of education and you're so well equipped to talk about physical activity, nutrition, and multiple other aspects of lifestyle that will be beneficial to your community. So that empathy, that understanding, and your willingness to explore what health equity means and how you incorporate it into your practice would be kind of the take-home message that I would like to leave everyone with today.
Awesome. Thank you. And very well said. That empathy may be the most fundamental component for this, because many of us in fitness don't understand the struggles of people that are not. And so I think that's so important. Where can people go if they want to find out about all the stuff you're doing? I don't know if you've got a central location following you on LinkedIn, but is there a place you would like to direct our audience to if they want to find out more either about you or the things that you're talking about?
I'll definitely give you some links that you can include in the show notes. I am not as active on social media as I should be. I do have a website. It's called, well, two things. I have a website called Wingman Wellness, and happy to include that. It's www.wingmanwellness.com. And then also have a podcast that launched 2021 called Perfectly Planted. And on Perfectly Planted, we talk a lot about nutrition, physical activity, mindset, health behaviors, and also would welcome anyone to listen to us if you want to learn a little bit more about what I do and what I think is important in helping keep people healthy in this world.
I love it. Well, now you've added a podcast for me to listen to, so I appreciate that. And Wingman Wellness, I love the URL because it seems very appropriate for the coach-based approach that we were talking about earlier. Awesome, Daphne. This has been a great conversation. Before I let you go, I'm going to get to our last question that I always end the podcast on, and I have a feeling it's probably going to be very similar to the answer you just gave, but I love to ask this question to medical professionals because you sit on the other side of the table of this issue that I'm trying to address, which is, the wellness paradox in my mind is the gap in trust, communication, and interaction between fitness professionals and medical professionals. In your mind, what is the one piece of advice you'd give the fitness professionals to close off that gap?
I think my advice is that you are an important part of the care team. And you are not only a fitness professional, you are also a health coach, sometimes a life coach.
Mm-hmm.
And that by integrating and creating relationships with healthcare professionals who can refer to you so that they can expand their scope of ability to impact the lives of the patients they serve, that's a great opportunity. If you can integrate into their clinic, that would be great. But if you can create a bi-directional referral pathway that would allow you to become an integrated part of a shared care plan where physical activity, nutrition, all of the things that we do best is part of, it's as important as the prescription that they're written and that they take to the pharmacy. They need to be coming to you with that prescription for your 5,000 steps or your plant-based meal, because you are a skilled part of keeping people healthy and helping those who are managing a chronic disease do so successfully.
Awesome. Very well said. Daphne Bascom, thank you so much for joining us on the Wellness Paradox.
Thank you for this opportunity. I love the conversation and so blessed to be on the podcast today.
Well, I hope you enjoyed that conversation with Daphne as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares really make a difference for us. Any additional information we'd like to share with you from today's episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 77. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again next week, please be well.